Hello, all. Assalamu alaikum to everybody. This is Dr. Anand Kumar. I'm talking today on a very common issue which probably affects 80 to 90% of all people, low back pain. I'm sure every one of us has had low back pain at some time of their life. This is more so, especially in the present days, because our life has become more sedentary, and with the digitalization of all the services, most of us are stuck to our desktop or on the computers. If you look at the previous previous our parents and those people, they were much more active, because most of the work was physical, in the sense that they had to go to do certain things. Now most of the errands, even shopping, has become digital. So basically you're sitting in front of a computer and you're ordering whatever you want. So it has its benefits, but of course it also has its drawbacks. One of the main drawbacks is poor posture, poor muscle development, and back pain is a cause from all of this. So I'm just talking about generalized back pain. Back pain as such affects the entire spine. So if you look at the spine, we talk of the spine, we have a spine. This is a spine model which shows us, see, this is a cervical spine, this is a thoracic spine, and this is a lumbar spine. If you look at it from the side, you can see that there is lordosis. That means a natural curve of the neck is towards the back. And whereas if you look at the thoracic spine, the natural curve of the thoracic spine is to the front. So this is known as a normal thoracic kyphosis, normal cervical lordosis. Coming back to the lumbar area, again you have a lordotic spine. In the sense, this is a natural, position of the spine. Most of the time, low backache happens because either there is loss of this normal curvature, or aggravation or increase of certain things. Say for example, if you lose the normal lumbar curve, so the spine becomes straight. This happens when the muscles are stiff or the muscles are in spasm. The thoracic spine, if you look at it, it's a small, very insidious, or very subtle curve. But because of us sitting in front of the computer or on the desk, this aggravates or this increases. And when you see that, you see a lot of people with a big curve in the front, because they're all stooped down. So this causes back pain. This also is related to the muscle control. So we have the cervical spine, which is lordotic, which again, in case in front of the computers or in front of mobile especially. See, using the mobile is not wrong. I mean, we're not saying that, okay, mobile is bad for you. Of course, mobile has its own problems of, radiation, all that. I'm not going into the radiation part of it. I'm just coming to the usage of the mobile. See, for example, mobile usage per se, everybody as a habit takes the mobile, and this is how everybody sees. This is probably the worst you can do for your cervical spine. By putting like this, you're putting about 3 times to 4 times pressure on the disc and on the ligaments, and this gives rise to problem. So using a mobile, the best thing is to do is to raise your hand up, keep it at your eye level, and use a mobile. If better, even put on a chair, use your elbow rest and use a mobile. There is absolutely no harm in it. It does not cause any problem. Even while sitting on a chair, I'm just coming to the basics of how we have to conduct ourselves to prevent back pain. So first and foremost, let me go into the causes of back pain. So we have different causes of back pain. The most common is a mechanical back pain. A mechanical back pain can happen because of a poor posture, poor muscle control, or poor habits of ours. Okay, inactivity is another habit which we all have. We are not active as much as before. So that is one of the reasons which gives rise. Of course, a mechanical can be due to some pre-existing condition in the spine. You may have a problem, you may have an instability of the spine, you may have a defect in the spine, you may have a deformity which was there in your spine. So that is the mechanical part of it. Coming to the neurological part of the back pain. Neurologic back pain basically means any pain from the back which goes down to the leg, or from the neck which goes down to the hand, is called neurogenic pain. Basically, it is a pain which is transmitted along the nerves. So that is a neurogenic pain. Neurogenic pain happens when there is a inflammation, infection, or there is a compression of the disc, compression of the nerve by the disc. Whenever a disc prolapses, see, for example, I can show you this. See, this is a normal disc. if you can see. You see the red one. This is a disc which has come out or prolapsed. So this disc causes compression on the nerve, and that gives rise to sciatica, or the pain which comes down the leg. So that is the next neurogenic pain. Then you have what is known as a non-inflammatory or a non-mechanical pain. Any inflammation, any generalized condition for rheumatoid arthritis or any osteoarthritis, degenerative changes can cause this non-mechanical pain. So basically, I've given you a small definition. Actually, it's a working diagnosis or working definition and working classification for the back pain. Most common, I am now talking to the most common back pain, which is probably postural or muscular or something based on inactivity. We all need to realize that we have 1440 minutes in a day. So this is something which we have to do. Most of the common explanation a patient gives is, when I ask, are you active? He says, no sir, I don't have time. So there is no question of not having time. Like I told you, we have 1440 minutes in a day. So we need to dedicate 30 minutes to 45 minutes for activity, for keeping ourselves or keeping our back supple. So there is no question, like we have 8 hours to sleep, we have 8 hours to work. So we have to keep 30 minutes to 45 minutes to keep ourselves active. It doesn't matter, it doesn't mean that you have to go and do exercise in the gym, nothing like that. It is just that 30 to 45 minutes of any physical activity, whatever you enjoy. In case you like swimming, yes, swimming is a good activity, it's a fantastic activity. You can go for a swim, fantastic. If you like jogging or running, why not? Sure, why not? Please go down for that. Or a brisk walk. The weather is beautiful now. The weather is beautiful for a walk. So go for a brisk walk. This will help the muscle. So it helps you stabilize your heart rate. It gives you, cardiopulmonary relief. You will feel much better. Your heart rate will stabilize. Your muscle tone will improve. It will give you a general sense of well-being. So that's all we need to do. We need to just, if you need cycling, swimming, jogging, walking, whatever you want to play sports, tennis, badminton, whatever you are, just we need physical activity. That's the whole idea. It is not necessary that you need to go to the gym, go lift weights or do anything. No. Physical activity does not mean that. Physical activity means just for you to do some activity which you enjoy. This way you can sustain it. If you force yourself to go to the gym, you will go to the gym for about 5 days and then you will discard it. So I would suggest you all to pick up some physical activity which you enjoy and continue doing that. Some people love to play football, especially now it's a football season. Yes, why not? Please go around, do some good physical activity, do some warm-ups and then go down and play football. That's a great thing. Now coming to what is ailing us. As you can see, the back is covered by so many muscles. The protection of the back are these muscles. So this is what we need to look after. If you can look how many layers of muscles are there. If we maintain these musculature, most of the backache is non-existent. Most of our backache is when we don't have any muscle power or muscle strength, or when these muscles are weak. So we need to strengthen these muscles. Like I told you, brisk walk or a jog is the best exercise you can do for yourself, cardiovascularly, also for the back muscles. So that is what we need to do, 30 minutes to 45 minutes of brisk walk. Now coming to posture, like I told you, we all sit in front of the desk, sit in front of a computer for long hours. In fact, even I myself sit in front of in my table in my consultation room for about 8 hours. But to make up for this, I need to go do physical activity for 45 minutes. And even when we are sitting at the desk, it's a simple rule. Every 15 minutes, try to make an excuse. Get up from the bed. Don't become stagnant. Basically, as we all know, a stagnant water contains dirt or collects germs. Moving water is fresh. So same thing with us. We got to get up and move. Every 15 minutes, find an excuse, pick up a glass of water, go do something and come back. That way you are keeping your muscles active, you are keeping yourself supple, you are keeping movement. Basically that's what my whole talk is about, movement. Mobility is the answer for everything. We need to move, we need to be mobile, and if we are mobile, most of our problems are non-existent. Of course, yes. Now coming to a real cause, sometimes yes, because of this we have a disc disease, we can have a disc prolapse, we can have stenosis. Stenosis basically means, we have a normal canal of the spine. So this canal contains the spinal cord. So if this canal, because of age, like osteoarthritis, whatever, if this canal becomes narrow, so this compresses the neural structures. This is called stenosis of the spine or the spinal canal stenosis. So these are structural changes in the body. These require medical care. So first and foremost, most of us, as we know, we have back pain. Every back pain does not mean that you run to the hospital. No, it does not mean. You just need to take some simple analgesics, just improve your posture, put some local gel, warm water fermentation, see how you are. If the pain still persists and if you're not better, yes, you need to consult. So what are the red signals for a back pain? The red signals for back pain are basically pain which radiates from your back to your legs or from your neck to your hands. So this is called radiating pain. Like I explained to you before, this is neurogenic pain. So that means the nerve is involved in this. Whenever there is a radiating pain, yes, you need to consult the orthopedic surgeon. They need to examine you for this. So what is the other red signals or things which you need to do? If there is pain at rest, even at rest, if the pain is there, or if there is any weakness in any of your limbs, hands or legs, yes, you need to immediately come to the hospital. If there is any disparity or if there is any problem while passing urine or passing your motions, yes, or any sensory deficits or sensory problems around your private areas, yes, these are very dangerous signs. These you need to come to the hospital as soon as possible. When you come to the hospital, what we do, we do a thorough clinical examination. With a thorough clinical examination, probably most of the diagnosis we can make out. We can find out what is causing you the problem. We then do investigations to consolidate our clinical examination, basically to confirm whatever we have seen clinically. So we have all facilities here at Sharq, as you know. We have X-rays, we have MRIs, we have CT scans, we have all the modalities of investigations. We even have DEXA scan. So we can do all these examinations. So when do we do a DEXA scan? In a person who is aged, or a person who is, or a lady who is postmenopausal, who has persistent back pain, yes, the cause can be osteoporosis. Osteoporosis basically means deficiency of calcium in the bone. So basically the bone is not as strong as it's supposed to be. So in that case we do what is known as a DEXA scan. A DEXA scan gives us the bone strength or the bone profile. So we do a DEXA scan. We can do an X-ray. Initially most of the investigations with an X-ray. An X-ray will show us the bone, will show us the disc space, will show us the alignment of the spine. With this, we are able to come to a diagnosis as to what could have caused the pain. In sometimes what happens is in an X-ray, if the disc space is reduced or if there is significant degenerative changes or significant instability on the X-ray, we further go into CT scan or an MRI. So basically an MRI is a magnetic investigation which is non-invasive. So basically with an MRI, we are able to see the soft tissues which are not visible on an X-ray. An X-ray is a bone window. Basically you can see the bone, whereas an MRI is a soft tissue window. Of course we can see bone, but we can see the disc, we can see the nerves, we can see the ligaments around the spine. So basically when we want more information, when we think we require more information to diagnose, we ask for an MRI. A CT scan is required when we need more information on the bone itself. For example, if there is a fracture, then we ask for a CT scan of the cervical spine. When we suspect that the bone is weak, then we ask for a DEXA scan. So these are the main investigations which we do with this in relation to back pain. Then coming to the treatment, most of the back pains are easily treatable. In fact, 80 to 90% of the back pains subside with a good analgesics, good physical care. We sometimes do give a muscle relaxant, a non-steroidal anti-inflammatory, local gel, warm water fermentation. In case sometimes when this does not suffice, we ask for physiotherapy. Physical therapy basically means we have different modalities. We have short wave, we have ultrasound. These are different modalities which are used to to relax the muscles. Also, short wave, um, short wave diathermy brings down the inflammation of the structures behind, and ultrasound brings down the muscle spasm. So these are the physiotherapy which we have. A physiotherapist also basically educates you how to look after your back. We'll also show you exercises to strengthen the back muscles. So the next stage of treatment is going into physical therapy. So when these two things don't work, then we have other different modalities. In case there is a structural problem, yes, we need to investigate further. If there is a structural problem, or if there is instability of the spine, we need to stabilize the spine. If there is a disc which is compressing the nerve, medication and physiotherapy may not help, because you have a physical problem, you have a disc which is pressing on the nerve. This will not suffice. This conservative treatment will not suffice. In about 20% of the cases, we need to do a discectomy. Discectomy basically means a small surgery. See, initially we used to do major surgery. We used to open the lamina, so it used to be an open surgery, and that would take much more time to recover. It was a what you call more aggressive surgery. Now we have what is known as a keyhole surgery. It's a very small surgery. We just go only remove that side of the disc. We just make a small incision without breaking any bone. So we go down, just remove the disc. This way, the rehabilitation. For example, if you do the disc surgery now, the same evening you will walk. The next day you will walk, and you will be discharged from the hospital. So this is now as simple as that. So it is basically a minimal surgery, but the disc compression is removed. Once the disc compression is removed, your neurogenic pain, or the pain which is radiating, disappears. So that is a easy thing. We also have another option. Sometimes when the disc is just causing inflammation, we can even give a small steroid injection. As we all know, everybody gets worried when we say steroid. Steroid given intravenously is different, whereas steroid given locally is different. A steroid given locally acts as a local anti-inflammatory. A steroid is probably the most potent anti-inflammatory ever available. So in some cases, even the anti-inflammatories which we give by orally does not suffice, we give a local infiltration of a steroid. We take a small injection and infiltrate the part with a steroid. This acts locally. Yes, some of it is absorbed systemically, but it's all excreted. So there is no danger. It is not a dangerous thing to give you a local infiltration of steroid, contrary to belief, like everybody thinks, oh, you should not take a steroid. So this is to rule out that fact that there is no problem in taking a local steroid to bring down the inflammation. Sometimes, when there is instability of the spine, so what happens is one of the spine starts to move over the other spine. This is called a listhesis, and this is a mechanical issue. This is basically an instability of the spine. This needs to be stabilized. We fix that unstable part with a fixation, and the whole spine becomes stable, and he has no problems. So surgery is not something which people should be afraid of. Surgery is something which will benefit. So a lot of people have this mindset, or a block, saying that no, I will never get surgery done. No, there is no point in suffering. If there is a disc which is compressing your nerve root, there is no point in suffering and going to Ayurvedic treatment, going to Bangkok, going to that sort of a massage. It doesn't help when you have a neurogenic pain, when you have a cause. Like for example, your finger is stuck in the door. There is no point in taking medicine. You need to open the door and release your finger. This disc works the same way. When you have a disc which is protruded, a disc which protrudes means the disc which comes out of its place is like your toothpaste. Once it comes out, it doesn't go back. You need to take it out. Same thing with a disc. When the disc is extruded and has come out and is compressing a nerve root, it does not go away. So if it is compressing and causing you persistent pain which comes down, you need to resolve it. The only way to resolve it is do by surgery. There is no need for you to suffer for 2 years and then after 2 years go for surgery. If there is a disc which is not getting resolved in a few weeks, and the pain is persistent, or if there is compression of the nerve which shows by either by sensory deficit or a motor deficit, it's much better to get it removed, go on with your life and enjoy life. So I want to just conclude my speech by saying most of the back pain is preventable. Most of the back pain we need is in our hands. So whether we get a back pain or we don't get a back pain, or if the back pain passes, is in our hands. Like I told you, mobility is the answer. We have to be mobile, we have to be active. In the present day, especially computers, and we have, everybody is stuck on the computers and ITs. We have to be mobile. You sit on the desk, you have to get up and get moving. So, and good posture, like when you are sitting, always sit up upright, put a good support onto your back, and keep your elbows here and use the thing. These are the few things which you can do. Or when you are lifting a weight, don't bend at the spine. Use your knees, sit a little and go up. So you can use partly on your spine, partly on your knees. So this way you are distributing the load and you're not putting stress on the back. So these are a few things we need to do. We need to have a healthy habit, become active, good posture, take care of our backs, and most of the things are resolved. But if a pain is persistent, please don't refrain or take a local medication or do some unwanted massage. Come, have a look. The doctor will be able to tell you if it is a mechanical back pain, or if it is a structural problem, or if it's a disc problem, and we can resolve it. A good physiotherapy, good analgesic will solve most of the back pains. And what cannot be resolved with this simple treatment, there are all sorts of treatments available here. We have a very good spine surgeon who comes visiting to us. He's from Italy. He's one of the best spine surgeon you can get. Please come here. We can make you see him, consult him, take all the things. You are welcome anytime. Thank you very much. Thank you very much for listening. I hope this talk has given you some information to take home, something so that will make you active and resolve most of your problems. Thank you very much.